Everyone needs screening. Everyone's at risk for colon cancer, and that's the scary thing. It is thought from all the techniques and the studies that have been screening studies that have been done up to now that we could prevent up to 90% of colon cancers if we could just remove every polyp before it became a cancer. A polyp is a growth in the wall of the colon, like a mole or something like that. Some polyps will go on and turn into a cancer. The reason cancer is bad is because it spreads, and that's how why people get sick. If it just sat there like a little polyp and never did anything, it wouldn't be so bad. But as it gets bigger, it can block the wall of the colon so things can't get out. It can grow into the wall, and that way spread to liver and lungs, lymph nodes, and that's the way it causes illness. It's in the spreading process and the growing process. There are no symptoms. You can't feel a polyp, and very rarely, only if it's the right place and the right side, it may give you a little bit of blood either in your stool that you can see or that we can test for.
Colonoscopy is a test that would be recommended by your physician, ordered by your physician, and should be performed beginning at the age of 50 for all patients at average risk. By average risk, we mean that men and women who do not have a family history of colon cancer and who do not have certain underlying chronic illnesses that may predispose them to an increased risk of colon cancer. There are certain chronic illnesses that may predispose you or put you at an increased risk for developing colon cancer, and one in particular is inflammatory bowel disease, including Crohn's disease or ulcerative colitis. Men and women who do not have a family history of colon cancer and who do not have certain underlying chronic illnesses that may predispose them to an increased risk of colon cancer should all begin screening at the age of 50. If you're African American, you should begin screening at the age of 45. So the recommended test is to undergo a colonoscopy, and that's the most effective way of preventing colon cancer, because during a colonoscopy, the physician will take a look at your entire colon, and if they see polyps or outgrowths that are precancerous lesions, they're able to remove that during the colonoscopy. Additionally, if they find a colon cancer at that time, if it is at an early stage, it can be addressed in the most effective manner and you have the best outcomes. There are other potential mechanisms by which to prevent colon cancer and to screen for them, including tests such as stool tests that can test for blood in the stool that may be an early sign of colon cancer, or additionally a shorter colonoscopy called the flexible sigmoidoscopy. However, these are not quite as optimal as undergoing a colonoscopy for prevention. So the day or two prior to undergoing a colonoscopy, the most important thing that a patient can do is make sure that they have an adequate and a very good prep. That will allow the physician performing the colonoscopy to be able to get a good look inside the entire colon and to detect any polyps that may be present or cancerous lesions. If there is an inadequate prep or a poor prep, then it's possible that the colonoscopy may have to be repeated or repeated at a shorter interval than would otherwise be recommended if a good prep was performed. The prep involves having a clear liquid diet only the day prior to the examination, and most importantly, to be drinking a solution. There's various types of preps. One that is most commonly prescribed now is called a Miralax and Gatorade prep. The Miralax Gatorade prep, which is now available, has an improved taste because you are using the Gatorade in place of having more of a sulfite-based solution.